editor, Gary Gibbon, who's outside number 10, with the very latest. Gary.
Was a curtain raiser to this statement tonight. There's been quite a row going on between the component parts of the United Kingdom. Welsh and Scottish governments in particular feeling that they haven't been kept in the loop. Nicola Sturgeon feeling that she was having to read about the Prime Minister's plans in newspapers rather than what she would consider through a more orderly fashion. And I think there is some concern that what he's going to announce here tonight is something that they're not going to feel they can go along with, even though parts of it they don't really quite know what the full detail is. By the way, we're going to get more detail in a large document and a statement to the House from the Prime Minister tomorrow. There was a clue in one meeting earlier in Downing Street this morning about where this was all going. The Chief Medical Officer saying to those who were on a call that he's convinced that there is a profound difference in the ability of COVID-19 to communicate itself, to be infectious in the open air. And I think we are going to see a significant loosening of those restrictions that were put down by the Prime Minister in the shutdown when it comes to outdoor activities. Again, something that might not be repeated in other component parts of the United Kingdom. That shutdown statement, by the way, that he originally launched all of this with, I think about half, maybe even smaller, the size of tonight's statement. And I think that gives you a little bit of a clue of the complications that the government are finding. Shutdown itself an extraordinary moment, but trying to unwind from it and keep on the right side of the science is proving incredibly difficult. What we're about to hear, I think, was a words broadcast that was much filled with in the course of the day, a sign of just the anxiety around it.
Gary, thank you very much. And Boris Johnson, of course, made a very sombre, live televised announcement on Monday, March the 23rd, urging people to stay at home. So let's see this new broadcast from the Prime Minister now.
It is now almost 2 months since the people of this country began to put up with restrictions on their freedom, your freedom, of a kind that we have never seen before in peace or war. And you have shown the good sense to support those rules overwhelmingly. You've put up with all the hardships of that programme of social distancing because you understand that as things stand, and as the experience of every other country has shown, it's the only way to defeat the coronavirus, the most vicious threat this country has faced in my lifetime. And though the death toll has been tragic and the suffering immense, and though we grieve for all those we have lost, it is a fact that by adopting those measures we prevented this country from being engulfed by what could have been a catastrophe in which the reasonable worst case scenario was 500,000 fatalities. And it's thanks to your effort and sacrifice in stopping the spread of this disease that the death rate is coming down and hospital admissions are coming down. And thanks to you, we protected our NHS and saved many thousands of lives. And so I know, you know, that it would be madness now to throw away that achievement by allowing a second spike. We must stay alert. We must continue to control the virus and save lives. And yet we must also recognise that this campaign against the virus has come at colossal cost to our way of life. We can see it all around us in the shuttered shops and abandoned businesses and darkened pubs and restaurants. And there are millions of people who are both fearful of this terrible disease and at the same time also fearful of what this long period of enforced inactivity will do to their livelihoods and their mental and physical well-being, to their futures and the futures of their children. So I want to provide tonight for you the shape of a plan to address both fears, both to beat the virus and provide the first sketch of a roadmap for reopening society, a sense of the way ahead, and when and how and on what basis we will take the decisions to proceed. I'll be setting out more details in Parliament tomorrow and taking questions from the public in the evening. I've consulted across the political spectrum, across all 4 nations of the UK. And though different parts of the country are experiencing the pandemic at different rates, and though it's right to be flexible in our response, I believe that as Prime Minister of the United Kingdom, Scotland, England, Wales, Northern Ireland, there is a strong resolve to defeat this together. And today, a general consensus on what we could do. And I stress could, because although we have a plan, it is a conditional plan. And since our priority is to protect the public and save lives, we cannot move forward unless we satisfy the 5 tests. We must protect our NHS. We must see sustained falls in the death rate. We must see sustained and considerable falls in the rate of infection. We must sort out our challenges in getting enough PPE to the people who need it. And yes, it's a global problem, but we must fix it. And last, we must make sure that any measures we take do not force the reproduction rate of the disease, the R, back up over 1, so that we have the kind of exponential growth we were facing a few weeks ago. And to chart our progress and to avoid going back to square one, we're establishing a new COVID alert system run by a new joint biosecurity centre. And that COVID alert level will be determined primarily by R and the number of coronavirus cases, and in turn, that COVID alert level will tell us how tough we have to be in our social distancing measures. The lower the level, the fewer the measures, the higher the level, the tougher and stricter we will have to be. There will be 5 alert levels. Level 1 means the disease is no longer present in the UK, and level 5 is the most critical, the kind of situation we could have had if the NHS had been overwhelmed. Over the period of the lockdown, we've been in level 4, and it's thanks to your sacrifice we're now in a position to begin to move in steps to level 3. And as we go, everyone will have a role to play in keeping the R down by staying alert and following the rules. And to keep pushing the number of infections down, there are 2 more things we must do. We must reverse rapidly the awful epidemics in care homes and in the NHS. And though the numbers are coming down sharply now, there is plainly much more to be done. And if we're to control this virus, then we must have a world-beating system for testing potential victims and for tracing their contacts, so that, all told, we're testing literally hundreds of thousands of people every day. We've made fast progress on testing, but there is so much more to do now, and we can. When this began, we hadn't seen this disease before, and we didn't fully understand its effects. With every day, we're getting more and more data. We're shining the light of science on this invisible killer, and we will pick it up where it strikes, because our new system will be able in time to detect local flare-ups in your area, as well as giving us a national picture. And yet, when I look at where we are tonight, we have the R below 1, between 0.5 and 0.9, but potentially only just below 1. And though we have made progress in satisfying at least some of the conditions I have given, we have by no means fulfilled all of them. And so, no, this is not the time simply to end the lockdown this week. Instead, we're taking the first careful steps to modify our measures. And the first step is a change of emphasis that we hope that people will act on this week. We said that you should work from home if you can, and only go to work if you must. We now need to stress that anyone who can't work from home, for instance, those in construction or manufacturing, should be actively encouraged to go to work, and we want it to be safe for you to get to work. So you should avoid public transport if at all possible, because we must and will maintain social distancing, and capacity will therefore be limited. So, work from home if you can, but you should go to work if you can't work from home. And to ensure you are safe at work, we've been working to establish new guidance for employers to make workplaces COVID secure. And when you do go to work, if possible, do so by car, or even better, by walking or bicycle. But just as with workplaces, public transport operators will also be following COVID secure standards. And from this Wednesday, we want to encourage people to take more and even unlimited amounts of outdoor exercise. You can sit in the sun in your local park, you can drive to other destinations, you can even play sports, only with members of your own household. You must obey the rules on social distancing, and to enforce those rules, we will increase the fines for the small minority who break them. And so, every day, with ever-increasing data, we will be monitoring the R and the number of new infections and the progress we are making. And if we as a nation begin to fulfill the conditions I have set out, then in the next few weeks and months, we may be able to go further. In step 2, at the earliest by June the 1st, after half term, we believe we may be in a position to begin the phased reopening of shops and to get primary pupils back into schools, in stages beginning with reception, year 1 and year 6. Our ambition is that secondary pupils facing exams next year will get at least some time with their teachers before the holidays, and we'll shortly be setting out detailed guidance on how to make it work in schools and shops and on transport. And step 3, at the earliest by July and subject to all these conditions and further scientific advice, if and only if the numbers support it, we will hope to reopen at least some of the hospitality industry and other public places, provided they're safe and enforce social distancing. Throughout this period, the next 2 months, we will be driven not by mere hope or economic necessity. We're going to be driven by the science, the data, and public health. And I must stress again that all of this is conditional. It all depends on a series of big ifs. It depends on all of us, the entire country, to follow the advice, to observe social distancing, and to keep that R down. And to prevent reinfection from abroad, I'm serving notice that it will soon be the time, with transmission significantly lower, to impose quarantine on people coming into this country.
Soon?
And it's because of your efforts to get the R down and the number of infections down here that this measure will now be effective. And of course, we'll be monitoring our progress locally, regionally, and nationally. And if there are outbreaks, if there are problems, we will not hesitate to put on the brakes. We've been through the initial peak, but it's coming down the mountain that is often more dangerous. We have a route and we have a plan, and everyone in government has the all-consuming pressure and challenge to save lives, restore livelihoods, and gradually restore the freedoms that we need. But in the end, this is a plan that everyone must make work. And when I look at what you've done already, the patience and common sense you've shown, the fortitude of the elderly, whose isolation we all want to end as fast as we can, the incredible bravery and hard work of our NHS staff, our care workers, the devotion and self-sacrifice of all those in every walk of life who are helping us to beat this disease: police, bus drivers, train drivers, pharmacists, supermarket workers, road hauliers, bin collectors, cleaners, security guards, postal workers, our teachers, and 1,000 more. The scientists who are working round the clock to find a vaccine. When I think of the millions of everyday acts of kindness and thoughtfulness that are being performed across this country and that have helped to get us through this first phase, I know that we can use this plan to get us through the next. And if we can't do it by those dates, and if the alert level won't allow it, We will simply wait and go on until we've got it right. We will come back from this devilish illness. We will come back to health and robust health. And though the UK will be changed by this experience, I believe we can be stronger and better than ever before, more resilient, more innovative, more economically dynamic, but also more generous and more sharing. But for now, we must stay alert, control the virus, and save lives. Thank you very much.
Well, there was the Prime Minister, a pre-recorded broadcast. I'll be joined shortly by our political editor, Gary Gibbon, and here in the studio by our health and social care.
So that was interesting, and what comes across to me is that Boris has obviously had a lot of training on how to deliver his speeches in a way that will give confidence.
Probably been watching BBC Bite-Size.
It was there, so he's probably watching BBC Bite-Size so that he knows how to deliver his speech. It was very different from the bumbling buffoon that we had in the first one. He's obviously been fed back the information that not many people have faith in him, so...
Ha ha ha, what a funny book. Really cheering me up during this pandemic. I might order the audio book as well.
Oh, sorry, I didn't see you there. Matt Lucas here, and welcome to Reasons to be Cheerful. And coming up on the show tonight, Natalie Cassidy offers some cooking tips.
First, you line the tray with some rich tea biscuits.
Kevin McLeod faces his toughest grand design yet.
This time, I come to meet an extraordinary man who's held a lifelong ambition.
And Dawn French sings.
If you want to know what's wrong from right, face must listen to what the terrors say.
So watching the news this morning in response to Boris's speech yesterday, I think we're going to get another even bigger peak in the next 2 weeks as people go out and can't stick to social distancing and see people. Yeah, it's not a good idea. Not a good idea.
Writing in English and finishing off with your pick of the day with Prince Charles. No, sorry, that's...
This week's learning is BBC Bite-Size.
We're revamping Mondays. Yes, from now on, Mondays shall henceforth be known as Motivation Monday. Thank you.
Chilly out there.
That Mrs. Cobbett is taking on. Everyone comes out to see what's the matter. I'm terribly sorry, said the ice cream man. It just looked like a good spot to sell ice cream. Tell you what, Mrs. Cobbett, he said, if you will step into my van and sell my ice creams for me this morning, I will go and plaster your ceiling for you. Now, how's that? That's ever so kind, said Mrs. Cobbett. And I'll mend the rafters, offers Chippy Minton, if Mr. Munnings will wait a bit longer for his chair. By all means, said Mr. Munnings. But I thought you said there was a branch sticking through the roof. Won't it have to be moved before you can do the ceiling? Nobody had thought of that. Leave it to me, says the man.
Oh, very cool.
Let's do the second coat later. Daddy, better not have lost my football valve. Can't find it. What did you find?
Oh, okay.
Where did you put that, Matthew?
So I want to give you a quick sum up of COVID-19 so far. We heard about it. Some people thought it was going to be the worst thing in the world, and some people thought it was flu. And then everybody realised it was actually quite bad. So then we waited for the government to tell us to stay in, because we couldn't use our own logic and common sense to stay in. And then when they told us to stay in, we did stay in for a little while. I say we, as in the general population. And then we got bored of staying in, and then we thought, well, we'll go out now, because it's going to stay, so we've just got to get on with it. And the peaks happened, and so we'll start going out, and the roads have got busier, and the beaches got busier, and there was arguments about whether you could swim or whether you couldn't swim. And then some people started meeting up and having parties, and other people started inviting relatives around at a 2-metre safe distance, because they could see logically that was no difference from having a 2-metre distance between a stranger when you're out for your daily walk. And then Boris obviously had some speech training and delivers. I forgot to mention that Boris had COVID-19 and apparently nearly died. And then had a baby. Sick baby? Not sure. I think there was a couple of abortions in there somewhere as well. Anyway, he had some training to deliver a speech, and you could certainly tell that there was some input there, and it was a very meaningful speech, and we will get through this despite the fact that we've cocked up so far. But we will, and you're all doing so well. You're all doing so well. Keep at it. British spirit and all that. And so we were told that now we don't have to stay at home. We can actually go out all day long if we want to, but we must maintain a 2-metre safe difference. And we must be aware, because being aware will help. And we've sent all the factory workers back to work, which is basically a lot of the population on a lower income. So we're just sending the poor people to work to be guinea pigs. We'll see how they fare. If they survive, we'll be okay. If they don't, we don't know. All you white collar workers, you can stay at home working from home. That's fine. And that's basically where we're at now. How many weeks in? I think it's 8 weeks officially lockdown. And obviously we started a little bit before that. So that's the summary of COVID-19.
First of all, I want to update you on the latest data in our fight against coronavirus. I can report through the government's ongoing testing and monitoring programme that as of today, 1,921,770 tests for coronavirus have now been carried out in the UK, including 100,490 tests carried out yesterday. 223,060 people have tested positive. That's an increase of 3,877 cases since yesterday. 11,401 people are currently in hospital with coronavirus, down from 11,768 the previous day. And sadly, of those tested positive for coronavirus across all settings, 32,065 have now died. That's an increase of 210 fatalities since yesterday. This figure includes deaths in all settings, not just in hospitals. Before we begin questions from the public and from the media, I just want to remind people of a number of important things I said in my address to the nation last night. Can we have the first slide, please? First, in order to monitor our progress, we are establishing a new COVID alert level system. The COVID alert level has 5 levels, each relating to the level of threat posed by the virus. The level will be primarily determined by the R value and the number of coronavirus cases. In turn, that COVID alert level will determine the level of social distancing measures in place. And the lower the level, the fewer the measures, the higher the level, the stricter the measures. Throughout the period of lockdown, which started on March the 23rd, we've been at level 4, meaning a COVID-19 epidemic is in general circulation, and transmission is high or rising exponentially. Thanks to the hard work, sacrifices of the British people in this lockdown, we've helped to bring the R level down and the number of infections down, and we're now in a position to begin moving to level 3 in steps. Next slide, please. And we set out the first 3 steps we will take carefully to modify the measures, gradually ease the lockdown, and begin to allow people to return to their way of life. But crucially, while avoiding what would be a disastrous second peak that overwhelms the NHS.
That will happen.
After each step, we will closely monitor the impact of that step on the R and the number of infections and all the available data, some of the measures today. And therefore, our advice to people what to do. We've also updated our messaging. We're now asking people to stay alert, control the virus, and save lives. And yes, staying alert for the vast majority of people still means staying at home as much as possible. But there are a range of other actions we're advising people to take as we modify our measures. People should stay alert by working from home if you can, limiting contact with other people, keeping distance if you go out, 2 meters apart where possible, washing your hands regularly. Well, thank you very much, Scott. What we're saying, and I'll ask Chris and Patrick to comment. What we're saying is that you can go to the park to exercise on your own, certainly in an unlimited way. You can go with members of your own household. But if you want to meet somebody from outside your household, it's got to be you and that other person, just as a pair, and you should observe social distancing while you're there. And so it should be basically a one-on-one thing, but with social distancing. So keeping.
So what I think it's like is when, if ever you've made a game up with the kids or anything, or when you were little, and you make a game and then you start playing the game and then you realise it doesn't work and then you have to tweak it and then you have to start again because you think it doesn't work doing it like that. I feel like this is how it is. It's like making a game, and then every time you play the game you realise you have to tweak and change it.
That's very good for health, generally also good for mental health. A long period of time, and making things sustainable is extremely important. And the third reason is that the scientists on the SAGE group looked at this and are confident that the risks of transmission outdoors are much lower than the risks of transmission indoors, but they are not zero. So we therefore want to take these modest steps, one stage at a time, and that's why the ministers and the government have decided to make this small change. It's an important change, but does not lead to people meeting with multiple people outside their household at once.
Yes, so Chris, just to get to exactly what Scott was asking, I think what he was saying was, can we go and meet lots of members of our family in the park if each member is individually spaced 2 meters apart? And our answer to that at the moment is that pushing it too far.
Correct.
So you can meet other people in the park, but it should be one other person from another household and observing social distancing. Patrick, is there anything you want to?
No, that's exactly right, and it's important that we take these very small steps, because that's the way we're going to know what the effect is. We can monitor it, we can see what effect that's having on the R and on the numbers, and only by knowing that that's a small difference can we then move to the next step. So doing this step by step, monitoring carefully.
And we won't be able to deliver stages 2 and 3.
When will it be over?
Pace that they're currently set out to do. Let's go to Simon.